Hello, this is Barb Michaels, Prevention Coordinator at the ADRC of Brown County, and with me is my colleague Brian Binder, Information and Assistance Specialist. Today we're going to share some information that we hope you find helpful to start a conversation with loved ones that will help you complete your healthcare advance directive. An advance directive for healthcare is a legal document that helps direct your medical care when you can't speak for yourself. It helps loved ones and your medical care team make and follow medical treatment decisions based on your wishes. Why should we talk about and prepare a healthcare advance directive? What if we are in an unexpected accident? An accident that contributes to our inability to speak. Maybe that's just for a day or two, or could be something longer term. What if we're diagnosed with a terminal condition and our prognosis of living is very short term? Who would make those decisions for us? Who would we most trust to carry out our wishes? And what medical treatment or intervention would we want? Something that is very minimal or the most extensive possible. We may tend to avoid completing a healthcare advance directive because of some of these reasons. One is we might feel young and healthy, whether that's in our 20s or in our 60s or 70s, and still feel in really good health and think that that can be done at another time. It might also be from lack of information or knowledge. We're just not sure what needs to be documented within a healthcare advance directive that would be helpful to our loved ones or to our medical care team. It might be that we've tried to talk to family members about it, but they just don't want to continue the conversation. It gets emotional. Or we're just not sure what to ask and who would be our decision maker if that were to be needed. Consider the why prior to starting the conversation. If you've avoided completing a healthcare advance directive, take time to list out and consider why it hasn't happened. Is it information that is needed, or additional education, or learning the feelings from your loved ones? Is it just a matter of finding the appropriate time where everyone can gather to hear and learn about your wishes? Is it not being certain of who you would designate to carry out your wishes and who could truly be that decision maker on your behalf? Are there other reasons? If you're not sure, consider seeking out others to get their thoughts to help initiate the conversation. When preparing to start the conversation with family, it's important to remind ourselves to also listen, to share first what we're thinking about for our wishes, and then acknowledge a time for others to share what's important to them, what they may have on their mind, or other experiences they want to share that can provide more insight as you document your wishes. Choose a good location that's away from distractions and at a good time that will avoid interruptions. Give yourself time. Perhaps this conversation can happen all at one sitting and you feel prepared to move forward and document your wishes. For others, it may take several times to come to a conclusion as to what you wish to document. Neither is right nor wrong.
A good technique to use when having a conversation with your loved one regarding advance directives is to try to begin with and incorporate open-ended questions if possible. Open-ended questions will allow your loved one to elaborate and share their ideas more broadly. It will also allow you as a listener to have a better understanding and will likely lead to more specific questions for you to ask as the conversation progresses. Some examples of open-ended questions that may be helpful are: tell me more about your thoughts. Can you help me understand? What do you know about? Specifically, you may ask, can you help me understand what matters most to you regarding your care if something were to happen? What would you want for your care? What wouldn't you want for your care? What do you know about advance directives and end-of-life decision making? Tell me more about who you would like to carry out your wishes at the end of your life. Again, open-ended questions are intended to help the listener gain more understanding and avoid yes or no conversation ending type responses. Another technique to utilize during the conversation is to attempt to reflect what your loved one is saying. Utilizing reflections in conversations allows you as a listener to clarify and make sure you understand what is being said, but more importantly, it lets your loved one know you're listening and you are engaged. Some common examples of reflections that you can use are, it sounds like, what I'm hearing you say is, so you're feeling, I get a sense that, it feels as though. These are not all inclusive. You certainly can come up with your own, but these are just some examples that are common. For instance, you may say, it sounds like you have given your end of life decision making a great deal of thought. What I'm hearing you say is that you're worried you and your daughter have too many other responsibilities right now. So you're feeling worried and overwhelmed with all that is going on right now. It feels as though you're ready to complete the forms. Utilizing reflections will give you as a listener some direction regarding what needs to occur or what needs to be resolved for the individual to make a decision and continues to allow the conversation to move forward. A useful phrase when problem solving with another person that I frequently utilize is find the why and find the way. Hopefully, with the use of open-ended questions and reflections, as a listener, you've identified some of the issues that need to be resolved in order for your loved one to complete an advance directive. Once you've narrowed it down and have a good idea of why they have not completed an advance directive to this point and their reasons for it, you should have some direction on what to do next. Simply, if it's a matter of time, set a time to do it with them. If it's a matter of knowledge and just not knowing how to go about getting and completing the forms, find the information for them. If they are not sure who to ask to be their decision maker or how to go about having that conversation with that person, continue to talk with them about options. Help them narrow it down if possible. Again, find the why and it will find the way. Moving forward with this conversation, you're going to want to have an idea of how ready your loved one is to making a decision. Hopefully, you've identified concerns and issues by utilizing open-ended questions and reflections, which we've discussed earlier. And naturally, you can assess how ready they are to make a decision regarding their advance directive. If you're having difficulty assessing their readiness or figuring out what their time frame is to complete the forms, a simple suggestion and skill is simply to use a 0 to 10 scale. You can use the 0 to 10 scale to determine how ready you are to complete a healthcare advance directive after talking about it. On a scale of 0 to 10, with 0 being not at all ready to complete a healthcare advance directive and 10 being I'm ready right now, where would you rate your readiness on that scale? Why? What would it take to move you higher? For instance, if an individual rates themselves as a 4 or 5, what would it take to move them up to a 6 or 7 as far as readiness? Are they concerned about who they're going to name? Are they concerned about the paperwork that's involved? Are they concerned about some decision at the end of their life that they're just not quite sure about? It's another way to get at the whys of what's prohibiting or what's keeping that person from completing the forms. This is just one tool that you can use, one to help identify readiness, but also again to identify a barrier that needs to be addressed during this conversation. Not all conversations are the same and they don't fit into a very nice template all the time. If you do get stuck, feel free to revisit some of these topics. One suggestion that I would have is to revisit why completing an advance directive is important. Ask the what ifs and the who woulds questions discussed earlier. What if they were in an accident? What if they were diagnosed with a terminal condition with a shortened life expectancy? What if they weren't able to communicate? Who knows their value system? Who would know their preferences regarding what medical care they want or wouldn't want? And again, who would they want to make those decisions for them? If you find yourself struggling and a bit stuck at this point, it might be useful to ask and discuss what would be gained and what are the benefits of completing a healthcare advance directive at this time. Simply would having a decision maker that's aware of their wishes and values regarding medical treatment and healthcare decisions be comforting to them? Or even the idea that they have the opportunity to have some say and some control in their healthcare decisions at a point when they may not have that ability. So they can designate that individual now and exercise their control now because they may not have that ability in the future. And that may be that's something to be gained, and that sometimes can be comforting. And lastly, they can hopefully avoid a legal guardianship court process, for their family and loved ones, which comes at not only a financial cost, but a cost of time as well, and bureaucracy with that. So completing an advance directive at this point, it's possible that they could avoid that process. These may be helpful to move the conversation forward with the individual. Finally, the last talking point is for the listener and the person initiating this conversation is to be prepared. If you are the loved one, if they're ready to move forward with completing and naming an agent, have the information ready, have the documentation ready, be prepared for who the witnesses may be, maybe be prepared to set up a time, to make that happen. Just be prepared and be ready to make that happen if the person is ready. You'd hate to hit the brakes on that. You want to carry that momentum of the conversation forward. You don't want to become a barrier. So it's nice if you're prepared and you're ready to do it. If you get a person that's ready to move forward with this decision and you're not sure, you need to have your own action plan. If you're not sure of what forms you need or what needs to be done, let that individual know that you'll find that information. So it's a good idea if you have that even prior to having the conversation, if you're familiar with the process and what needs to be done. So in closing, we just wanted to say thank you for listening, and we hope you find some of this information helpful and useful in taking the next steps to prepare your healthcare advance directive. We sincerely hope it helps you prepare and gives some peace of mind for yourself and that of your loved ones should a medical crisis occur.